So again, this survey was recorded in 2023, and the data reflects responses from over 100 MSK patients that were surveyed internationally. So the first question is, what age did you start having medullary sponge kidney symptoms? And the majority of the answers were early adulthood. And so most people started having MSK symptoms, whether they were urinary tract infections or chronic stones or flank pain or renal colic, around the age of 20 to 40. There were also a few incidences of the teenage years, which were 13 to 19, a few with early childhood, and a few at birth. And so the majority of people with MSK, which research backs this up as well, is recorded as the presentation is in early adulthood, so from 20 to 40. What age were you diagnosed? The majority of people were again diagnosed in early adulthood, and it states 77%, with a few being diagnosed in middle age. The next question is, how many kidney stones do you form or get per year? And the majority of patients, again, stated 50%. So 50% of the people surveyed got more than one stone per year, more than 10 actually. So that's a pretty high incidence. And again, that's really proof that MSK is not quite the benign disorder that we have been taught. On average, do you typically pass kidney stones naturally, or do you require medical intervention such as lithotripsy or ureteral stent placement? So the majority of people pass them naturally most of the time, but there is a smaller incidence, 38%, that said they require medical intervention. I am one of those people that do not pass them well. I do require stents just about every time. But it's interesting to see that there's that 38%. 77% reported that they have had to have the stent placements. How many stents have you had? 21% stated 1, 31% stated 2 to 5, 17% stated 5 to 10, and 29% stated more than 10. So definitely a high incidence of stent placement. Have you ever had lithotripsy? 72% of you said yes. How many lithotripsy procedures have you had? It was broken up to pretty, not super equal, but more so than this number. 32% said more than 10. Have you ever passed kidney gravel? And to explain this is kind of a marker for MSK. It's very specific to, the common symptoms of the medullary sponge kidney. And they're these small, little, almost sand-like kidney stone grains that a lot of MSK patients form. And from my research now, again, I'm not an MD or whatever, but I've seen that it's kind of synchronized to MSK. It's kind of a unique diagnosis that I've only seen in people with medullary sponge kidney, which is not to say that it's not in other conditions, but I've really seen a preeminence in medullary sponge kidney patients, a prominence. So 86% say yes, they have had these stone-like grains. 13% said no, but that's a very high incidence of the kidney gravel. Okay, so on average, how many UTIs do you get per year? So over half of the patients surveyed stated 52%. The 15% said none. God bless those people. The 17% said 5 to 10, and then there were the 14% that said more than 10. So that's definitely a high incidence of UTIs. How many times a year do you go to the emergency room for MSK related issues? The majority said 1 to 5. 21% said none, which I am glad to see. And then there was the 8% that said more than 10. So definitely shows that MSK is an intense condition that does require medical intervention at some points. This is probably the most important question that was asked, especially for a research standpoint. Do you have pain associated with your medullary sponge kidney? 97% of you said yes. And that's validating because, again, the research states, oh, it's a benign condition. It doesn't cause symptoms. And the fact that 97% of everyone surveyed stated that there is pain. And a lot of times in emergent situations, whatever, we are told that pain is only associated with obstructive stones. If the stone's not obstructive, it's not going to cause pain. But if you look at this number and talk to, any number of medullary sponge kidney patients, they're going to tell you that they do have pain, at least 97% of us, even without the presence of an obstructive stone. So that's a very important key point that I want to really put out to the world, not only just to physicians, but also other MSK patients, because it's very validating. We know we hurt. We're not making this up. We're not just trying to get, X, Y, and Z medications or get on disability or whatever. There really is some serious symptoms that come along with MSK. So if anyone's gaslighting you and telling you that there's no pain associated with this, take heart. 97% of you tell the same story. So how often do you suffer with MSK pain? 63% of everyone surveyed said daily. That is over half of people with MSK that took this survey. That's honestly a high incidence. And so again, it validates that this condition is unfortunately painful in some cases. And to keep going with the pain theme, do you suffer with kidney pain even when you're not passing a stone? 93% said yes. So again, very validating. We asked the question, do you take narcotic or other pain medications for MSK-related pain? 66% of you said yes. 33% said no. And to speak to that point, I know that the opioid crisis and things like that has put a lot of narratives out there. Opioids are seen as these killer things and whatever. But I just want to make the point that properly used, legally obtained medications give quality of life, improve quality of life if it's necessary. And it's not that opioids kill, it's opioid abuse that kills. And that distinction needs to be made. And again, I'm not faulting anyone for, if you struggle with addiction or whatever, that's a different battle. And I'm so sorry. But as far as my personal experience and my professional experience, as a naturopathic provider, there are times where medications, narcotics, analgesics, whatever, are indicated because unmanaged chronic pain can have some serious implications for negative health. Specifically, your adrenal glands can be very, very taxed if you're in a state of chronic pain that's unmanaged. I can tell you that because I worked in endocrinology the past 7 years and I have an adrenal condition myself. So unmanaged pain is absolutely detrimental to cortisol production, your adrenal glands, your endocrine system. And it puts you essentially in this fight or flight response that you're not meant to be in forever. So I just want to make that point again, that if you are requiring narcotic pain medications or any other medications, that no shame, make sure that, you're working with a healthcare provider that understands you, that can get you at an appropriate level. Obviously, if you start to have some, other symptoms, of addiction and things, you can have those conversations. But again, properly used opioids give quality of life, and opioid abuse is what kills. So that's off my soapbox for now. And again, if so, how often do you rely on pain medications to manage MSK-related pain? So 41% said daily, which again, pretty high incidence. 35% said intermittently, 8% said weekly, 12% said never. So again, high incidence, 41%, almost half. Do you take supplements or natural remedies to manage MSK-related symptoms? So 68% said no, 31% said yes. This is my realm of expertise as a clinical herbalist and holistic health practitioner. I have had to enlist a lot of holistic things to kind of manage my MSK, which again, I'm happy to have that conversation, but that'll be for another video. Next question, do you follow a special diet to manage MSK-related symptoms? 58% said no, and 41% said yes. This was an important question because, again, when you have kidney stone formation, a lot of the ways that I manage it personally and also my patients is the composition of the stone is going to determine, what dietary interventions and even pH balance and alkaline and acidity that you need to manage this condition. And so it's important to get that information because if, for example, if you have stones that form an alkaline urine, which I do, I have calcium phosphate. And there is a balance between acidity and alkalinity. And so, the catch-all for, kidney stone treatment is, oh, drink lemon water. Well, when you have urine that is alkaline, what happens with lemon juice? It increases your stone production because they're alkaline. I know the acidity, alkalinity, whatever, but I have seen it personally that if I get into anything that's citrus or lemons or anything like that, I have an increased stone production. Again, I'm not an MD. This is just personal experience. And I'm telling you that it's very important that you know what's going into your body so that you can figure out why your stones are forming. And again, you're not going to prevent totally every stone from forming because MSK is a congenital, like physical disorder where you don't have nephrons that formed correctly. So you might not be able to stop all stones, but you can definitely limit maybe the size of them and the frequency, which is what I have done, thankfully, through diet. So anyways, do you generally feel your doctor understands how to manage your MSK? 64% of you said no, and 35% said yes. So that's actually terribly unfortunate. But when you get into rare disease, that's a commonality. How many CT scans have you had specifically for MSK? 46% said more than 10. This is definitely an important question because when you have chronic kidney stones, obviously you're going to need to know where they're at in XYZ, especially if you're going to have surgery. So it's important that, you do have those imaging, but it also increases your radiation. And, there's risk involved with a lot of CT scans. I have probably had way too many, just to be honest. And I'm 31 currently, and it's just been a wild journey, but it's important that you keep track of that sort of thing. I know that there's like a number that's recommended that you're supposed to have max in lifetime, but you have to weigh quality of life. And if there's an emergent situation and you don't know if there's a stone obstruction or if there's, hydronephrosis, it's kind of a necessary evil. So I'm not saying obviously don't get the CT, but it's definitely good to not do anything that's not absolutely necessary. And again, not an MD, and I have this condition. And if you're in severe chronic pain, you definitely need to know what's going on. But it's also important to note that there is a radiation risk. And so if it's not absolutely necessary, there are other options like, an ultrasound and things like that, which is the next question. How many ultrasounds have you had specifically your MSK symptoms? So 40% of you said more than 10. 35 said 1 to 5, and then the 20% was 5 to 10. So, I mean, that's a decently sparsed out graph there. How many times in your life have you visited the emergency room due to MSK? More than 10 was 47%, 29% was 1 to 5, and then 18% is 5 to 10. I think that number is interesting because those of us that have been diagnosed younger, I feel like we have a higher number because we were diagnosed and we know that's to MSK. Next question. Do you feel your MSK symptoms are generally treated appropriately in an emergency care setting? 71% of you said no. Again, the emergency department is a very specific department. And what I mean by that is they're trained to handle acute situations and, car wrecks, heart attacks, broken bones, whatever. The ER is not a place for diagnostics. And honestly, it's really not a place for pain management, truthfully, which is not to say that they can't do other things and they won't. But their goal in the emergency department is to get you either home or admitted to the hospital if you need other care. The emergency room doctors are not going to be very well versed on MSK because it's a rare condition, which is one reason that I wanted the book published and available, because they can open up the book, see the symptoms, see these survey results, see the letter from Dr. Goldfarb, which is the nephrologist at NYU, who contributed to the book by putting his letter. There are validating factors. However, when you're in an ER, do not expect them to be MSK masters and don't expect them to do extensive diagnostics, because that's just not. And with kidney stones, typically people have 1 or 2 in their whole lifetime, and the standard procedure is give fluids, and they may or may not give pain medications depending on the discretion of the attending physician. Especially with the opioid epidemic trend that's going on now, they're probably not going to do that. But again, it's important to present information about this condition. So that's mainly why I wanted this information out there, and it is published in the book. Have you ever been told kidney stones should not hurt because they're not obstructive? This is probably the number one thing I've heard in the ED, which is crazy to me because there's literal calculi rock in the kidney and you're telling me it shouldn't hurt. Okay. Um, so 78% of you kind of agreed with that. You've had that experience, which is unfortunate. Do you have pain with stones even when they're not obstructive? 95% of you said yes. So that's a pretty large number that really validates what we're saying. Do you struggle with fatigue due to MSK? 95% of you said yes. This is another extremely validating point that I wanted to make sure was documented because when you have an invisible condition that people can't see and you say, oh, I'm tired, I'm exhausted, there's a difference between illness exhausted and normal people exhausted, which is not to invalidate anyone's experience, but I think when your kidneys are struggling and you have hydronephrosis or whatever, they don't understand that your body's already so taxed that anything extra is just exhausting. I know when I get hydronephrosis, it feels like a donkey's kicking me in the back, and there are tasks that I just can't do, like vacuuming or even kind of loading the dishwasher or getting clothes out of the dryer. Like it's so painful. I can't do it. And it's not that I'm lazy. It's just that my body is trying to handle a situation that is not normal. And so I just want to validate that if you have MSK, it's okay that you're extra tired. And it's not that you're lazy. Your body's dealing with more than the average person. The next question, has MSK impacted your mental health? 82% of you said yes. Not surprising. MSK, like I said, deals with chronic pain, UTIs. If you're on antibiotics a lot, there's documentation that antibiotics can affect microbiome, which can affect neurotransmitters, which can make you depressed, like X, Y, and Z. But you need these things to stay alive. And so I just want to validate as well that mental health can be impacted, and that's not your fault. Some stuff is just hard. So the next question, would you consider your specific case of MSK to be disabling? 36% of you said at times, 49% of you said yes, and 13% of you said no. So it's interesting that almost half of the people surveyed stated yes. I would definitely agree with that. And I think what's a misnomer about medullary sponge kidney and other chronic conditions as well is that people don't understand that there are exacerbations to the condition. Like some days are better than others. And if you're having like a lot of stones one week or something like that, it might be a struggle. And then the next week, maybe you just got your stents removed and your kidneys are clear and you're able to do whatever. Like, I don't think people understand that chronic illness is a fluctuation. And so I just, again, want to validate that if you feel like this condition's disabling, it's because, well, it is. That's the thing about disabilities, is that they're disabling, and we don't want to admit that. And obviously we don't want to mentally be like, oh, I'm disabled, I can't do anything. But you have to weigh the balance of acceptance and action. So again, 49%, almost half, said it was disabling. Have you tried alternative therapies to manage MSK? 68% said no. I put this in here specifically because I know that when I started out in my healthcare career, I was in Western medicine completely. I was in geriatrics, which is old people. Alzheimer's and dementia was my concentration. And I worked in a nursing home, and that's what I did. That was my thing. And when I ended up being diagnosed with both Addison's and MSK, I really struggled with just having the Western medicine. Like, medications are absolutely necessary. I am not ever going to tell you not to take X, Y, and Z, because I think pharmaceuticals, specifically antibiotics, are lifesavers. People will talk about how difficult it is in the modern day, but truthfully, antibiotics for people with chronic UTIs are life-saving, because if you think about it, 100, 200 years ago, people were dying of sepsis and all this stuff. And it's like, our life expectancy is not 42 anymore. Not that that's an actual number, but the incidence of needing antibiotics and things is prominent when you have MSK. So I'm not ever going to say don't do Western medicine, but what I am saying is there are alternative therapies that you can add to that to definitely help. And that's where I went back to school, got all my education in that after leaving geriatrics, because I myself saw myself struggling. And so that's why I run Hope Healing Happy Clinic now. But I'd be happy to have that conversation with anyone, because there are many alternative things that I know really help. And I put that in there because I think when you go to doctors, sometimes they look at you and say there's nothing else that you can do, and that's just not true. this is a big, big world, and not everything works for everyone, but you definitely have to find options, and there's always hope. So, next question: do you have any other health conditions other than MSK? 72% of you said yes. I'm not surprised to see that. Typically, the chronic conditions are buy one get five free. So you have if you get one, you typically get more. I know that happened with me. I developed adrenal insufficiency, which is basically where your adrenals stop working because they get mad at you. And I really think it's because I had unmanaged MSK for so many years, and then I was in the medical field and type A personality. But anyways, 72% of you said that you do have other conditions. And so, like I said, this was published this year, and it does show all the results from the survey. This is what the book looks like on Amazon. Manage Medullary Sponge Kidney, A Patient's Guide to Managing MSK by Winslow E. Dixon. It's free on Kindle Unlimited, and I wanted to make it available, like I said, because I feel like there's so much dissonance within the community, especially emergent situations where they don't know how to manage MSK, and you're almost gaslit because they're like, oh well, the stone's not going to cause pain, and it's like, bet. And then you know again, the opioid crisis and all that has really impacted emergent care and things like that. And when you go in an excruciating pain, and especially if you're a young person, which I'm not knocking old people, but I think that there's a stigma there that people are seekers or whatever. But I just want to remind everyone that pain relief is a human right, and you are valid in your experience. So again, that's why I wanted Managed Medullary Sponge Kidney published, because it has accurate information. Everything that I wrote is sourced with NIH studies, and it's not just like Dr. Google, Wikipedia. Like, these are studies that I found that backed up what we're all saying, the Journal of Nephrology, and Dr. Goldfarb's letter. And these are things that are undeniable proof that this condition is not benign. So I just want to encourage you guys that you're valid and your journey with MSK, and don't let anybody gaslight you and tell you that it's benign and it's whatever. If you're in pain, you're in pain, and your story is valid. So again, my name is author Winslow E. Dixon. My book is available on Amazon, and also I do take patients remotely on at my health clinic. So I will put those links below, and I truly hope that this video helped validate your story and will help future providers and physicians understand the nuances of MSK. So, wishing you hope, healing, and happiness. Thank you for watching.